MRI, or magnetic resonance imaging, uses magnetic fields and radio waves to view our internal structures. MRI shows soft tissues, but it can't see the air in our lungs. Xenon MRI changes that.
We use a physics principle called hyperpolarization to boost the signal of a small amount of xenon, an inert gas. The patient takes a single breath and holds it for about 10 to 15 seconds, and we can watch how the air distributes throughout the lungs.
So the gas itself becomes visible. Important safety information indication. XenoView, prepared from the Xenon Xe129 gas blend, is a hyperpolarized contrast agent indicated for use with magnetic resonance imaging, MRI, for evaluation of lung ventilation in adults and pediatric patients aged 6 years and older. Limitations of use: XenoView has not been evaluated for use with lung perfusion imaging. How does Xenon MRI help guide what we do clinically? What do we look at first?
We start with ventilation. The images show bright regions where air flows normally and dark ventilation defects where airflow is blocked, often because of small airway disease, hyperreactive airways, or mucus plugs. Because we're imaging the gas directly, we can see obstruction even when CT or spirometry look normal.
That means we can spot trouble areas that other tests miss. As a clinician, I could use this information not only to adjust therapy before things get worse, but to also guide procedures with greater precision and give patients a clearer picture of their own lungs.
Ventilation imaging with Xenon 129 is FDA approved for patients age 6 and up. It's inhaled, non-radioactive, and well tolerated. Clinical trials, including over 100 children with asthma and cystic fibrosis, reported mild, transient side effects.
Important safety information indication. Contraindications: none. Warnings and precautions. Risk of decreased image quality from supplemental oxygen. Supplemental oxygen administered simultaneously with XenoView inhalation can cause degradation of image quality. For patients on supplemental oxygen, withhold oxygen inhalation for 2 breaths prior to XenoView inhalation and resume oxygen inhalation immediately following the imaging breath hold. Risk of transient hypoxia. Inhalation of an anoxic gas such as XenoView may cause transient hypoxemia in susceptible patients. Monitor all patients for oxygen, saturation, and symptoms of hypoxemia and treat as clinically indicated. So we can safely use it in kids and get quantitative ventilation numbers for baseline and follow-up. That's huge. It can be used in kids who cannot otherwise do spirometry too.
We calculate the ventilation defect percentage, VDP, which can be used to characterize disease severity and track progression over time. VDP closely correlates with asthma severity and predicts exacerbations, hospitalizations, and steroid use. It also quickly shows if therapy is taking effect, so we can stratify risk and fine-tune treatment.
So it's more than just an image. It's a biomarker we can track over time at recurring intervals, without any concern about radiation exposure.
One interesting clinical use case is in patients with asthma and mucus plugs.
Recent reports show that biologics such as dupilumab can dissolve mucus plugs and reduce ventilation defects on Xenon MRI. When we start biologics targeting interleukin-4, interleukin-13, interleukin-5, or TSLP, Xenon ventilation MRI lets us watch those defects shrink. If the plugs don't clear, we have another objective piece of data to help us decide if we should adjust therapy.
When it comes to incorporating this into clinical practice, workflow is simple. We prepare the gas, the patient takes 1 breath, holds it for 10 to 15 seconds, and the scan is done. We can then get ventilation maps and VDP. It fits into a routine MRI session and keeps the focus on patient physiology. Xenon MRI also has established reimbursement pathways, making it accessible for clinical use.
So in under 15 seconds, we see airflow patterns. We get objective metrics to predict exacerbations, tools to monitor therapy response, and a chance to act before irreversible lung damage.
All radiation-free, child-friendly, and repeatable. This is transforming how we manage lung disease. And Xenon MRI isn't limited to asthma. We detect ventilation defects in COPD, cystic fibrosis, bronchiolitis obliterans syndrome after stem cell transplant, and other obstructive lung diseases.
Important safety information indication. Adverse reactions. Adverse reactions in adult patients. The adverse reactions greater than 1 patient in efficacy, trials were oropharyngeal pain, headache, and dizziness. Adverse reactions in pediatric patients. In published literature in pediatric patients aged 6 to 18 years, the following transient adverse reactions were reported: blood oxygen, desaturation, heart rate elevation, numbness, tingling, dizziness, and euphoria. In at least 1 published study of pediatric patients patients aged 6 to 18 years, transient decrease in SpO2%, and transient increase in heart rate were reported following hyperpolarized Xenon XE129 administration. Please see full prescribing information.